I'm John Strum, and this is Real Talk MS. It's August 24th, and we have a lot to talk about. And today, we're talking about the COVID-19 vaccines and the newly authorized third dose. We're all hearing a lot about the vaccines and the Delta variant, and there's a tremendous amount of social media buzz about that third shot. I know many of you have questions, so this episode of the podcast is going to run longer than the typical episode of Real Talk MS. There are a lot of nuances and details that we're going to work our way through to make sure that everyone in the MS community fully understands what this third vaccine dose is all about, who it's for, and when it might be for you. If you're a regular listener, you know that on this podcast, we defer to the science. So joining me once again to share reliable information that you can use with confidence in your own decision-making is Dr. Nancy Sicotte. Dr. Sicotte is a professor and chair of the Department of Neurology at Cedars-Sinai Medical Center in Los Angeles, where she's also the Women's Guild Distinguished Chair in Neurology and Director of the MS and Neuroimmunology Program. And Dr. Sicotte chairs the MS Society's National Medical Advisory Committee and leads its COVID-19 Vaccine Advisory Group. And a bit later in this episode, we'll also talk with Victoria Holmes, a nurse practitioner who specializes in pediatrics. Victoria received her Master of Science in Nursing from the University of Pennsylvania and is currently pursuing her Doctor of Nursing Practice degree. Victoria was diagnosed with MS 2 years ago, and like some others living with MS, Victoria was initially hesitant to receive the COVID-19 vaccine. But before we meet Victoria, it's my pleasure to welcome Dr. Nancy Sicotte back to the podcast. Thanks for joining me today, Dr. Sicotte.
My pleasure to be here with you, John.
Before we get into the realm of third shots and boosters, I'm hoping you won't mind once again answering two questions that I've asked before. The two questions some people living with MS continue to ask. So, are the COVID-19 vaccines from Pfizer, BioNTech, Moderna, and Johnson & Johnson safe for people with MS, and should people with MS be vaccinated against COVID-19?
John, thank you for raising that and giving me an opportunity to say yet again that these vaccines are definitely safe for people living with MS, and we absolutely recommend that everyone get vaccinated. And that advice becomes stronger and more sure as time goes on.
Are people living with MS at any sort of increased risk of getting COVID-19?
So this is a great question, and one thing that we worried about at the beginning of the pandemic, because it wasn't clear if certain groups of people would be more prone to getting infected with COVID. And it turns out that having MS is not a risk factor in and of itself for getting COVID, because the truth is all of us are susceptible to getting this novel coronavirus. So having MS in and of itself is not an additional risk factor.
The National MS Society's expert advisory group that you lead has developed guidance for people living with MS and making decisions around the safety and timing of COVID-19 vaccines with certain disease-modifying therapies. And I want to get into that in just a moment. But first, I want to ask, does a vaccine advisory group recommend one vaccine over another?
So, John, we don't. And that's because all three of the currently approved under the emergency use authorization, all three vaccines have been shown to be very safe and very effective at preventing severe illness from COVID and death.
So let's talk about those disease-modifying therapies and those vaccines. Most DMTs are not expected to have any effect on the efficacy of the COVID-19 vaccines, but we've heard that some disease-modifying therapies may make the vaccines less effective. What are those disease-modifying therapies that may affect vaccine effectiveness?
So let me get into that. But first, I just want to emphasize what you're saying, which is there's a difference between safety, and efficacy. So all of the disease-modifying therapies are safe to be used with the vaccine. So there's no problem with safety. But what we do know is that, and what we've seen evidence for and some data now, is that some of the drugs that people use to treat their MS and prevent them from having relapses may make the vaccines less potent, and they may have a less robust response to the vaccine. So those include, in particular, what we call the B-cell depleters. So that would be ocrelizumab and rituximab and now ofatumumab. These are drugs that affect certain part of the immune system, which are the B cells, which are important in the process of responding to vaccines. But they're not the only part of the immune system that responds to vaccines, which I think we'll probably get into. There's also some data that suggests that another class of medications, the so-called S1P inhibitors, may also result in a less robust antibody response to the vaccine. And those drugs include fingolimod, ponesimod, siponimod, and so on. So we do have some evidence there. And then other monoclonal antibodies like alemtuzumab, which is given annually, also suppresses B cells, at least in the first 6 months, and would be expected to perhaps lead to a less robust vaccine response.
Because some of these disease-modifying therapies can lead to that less robust response, I know that there are people in the MS community wondering whether that means they need to get an antibody test. Is there any guidance offered on that?
So it turns out that antibody tests are not used for and not recommended to be used for clinical decision making. And that's because that's not the only part of the immune response that's important, and we wouldn't necessarily make decisions about treatments based on that. And we do have some new data that's actually quite encouraging in this area, and that comes from Amit Bar-Or and his collaborators, who looked at immune responses in individuals who were on B-cell depleters. And we learned quite a bit from the work that they did. And one of them is that even though you may not be seeing neutralizing antibodies, there are other immune responses to the vaccine, which include T cell responses, and in particular CD8 T cells. And these confer protection against the virus as well. So that's good news, and also an indication that we should be recommending these vaccines, and it's useful for people who are on these disease-modifying therapies to get the vaccine, even if they aren't seeing their antibody tests change. So we're not recommending using those antibody tests for clinical decision-making.
And is it important to coordinate the timing of a vaccination with some of these particular disease-modifying therapies so that you gain the best vaccine response?
Yes, it's a great question, and one that causes, I think, some confusion. But in particular, the B-cell depleters, the ones that are given every 6 months, what we recommend and what the panel has recommended and is now up on the National MS Society website is waiting at least 3 months, so 12 weeks after you do your infusion with whatever B-cell depleter, whether it's ocrelizumab or rituximab, waiting that 3 months before you get your vaccine. And that's to increase the likelihood that your immune system will respond well to the vaccine. And then after you have your last shot, so the second shot, if you're doing the 2-shot regimen, waiting 4 weeks before you do your next infusion. And that's to allow your immune system to really respond to the vaccine and get the best bang for your buck, if you will. Now, again, to go back to the study that Dr. Bar-Or and his colleagues did, we did learn a little bit more about the relationship between that timing and waiting and immune responses. And it turns out the longer you wait, the more likely you are to have a better response to the vaccine. So while we are recommending at least 3 months, if the timing turns out and it's 4 or 5 or 6 months, that may turn out to be, would give you a more robust response. Now, this is, of course, something you should be discussing with your neurologist and your healthcare provider in order to, think about this, because it's nuanced, and you don't want to stop your disease-modifying therapies or change your schedule without discussing it with your healthcare provider.
We've been talking about this guidance for people who are on disease-modifying therapies. But what about people living with MS who are not on disease-modifying therapy? Should they be getting vaccinated?
Yes, and that makes it very simple because you don't have to worry about timing or anything like that. Just go out and get your vaccine. And my goodness, if there are any people living with MS who have not been vaccinated, please get yourself down, schedule it. There's plenty of vaccine around. Please go and get vaccinated. We're seeing with the Delta variant, it's just heartbreaking when we see people who are not vaccinated, who could have been vaccinated, who end up getting very ill and dying, and it's avoidable. So we definitely know now the vaccines protect people from severe COVID, keep them from coming to the hospital, and keep them from dying. So I hope that everyone listening, regardless if they have MS or don't, or they live with someone who has MS, whether they're on a disease-modifying therapy or not, please just go and get vaccinated. It's the only way that we're going to be able to protect each other and protect the hospitals, to protect the healthcare system. So I'll tell you, John, I'm on service right now, which means I'm here at the hospital on the weekend and seeing patients. And, we're seeing the numbers go up again here in Los Angeles. And it's just so, heartbreaking, and we worry that we're not going to have capacity then to take care of people who have heart attacks and who are giving birth and doing all the other things. So, please, if not for yourself, and think about the whole healthcare system, go out and get yourself vaccinated.
This past week, it was announced that people age 18 and older who have received 2 doses of the Pfizer-BioNTech or Moderna vaccine are eligible to receive a COVID-19 vaccine booster beginning in September. Additionally, people with MS aged 12 and older who were fully vaccinated with the Pfizer-BioNTech vaccine, and people with MS age 18 and older who are fully vaccinated with the Moderna vaccine, well, they may be eligible to receive an additional vaccine, a third shot now. What can you tell us about this third vaccine dose and its implications for people living with MS, and who should get an additional vaccine dose now?
Yes, so there's a lot going on the booster side. So let's see if we can break this down for people. So what we've learned over time is that certain groups of patients whose immune systems have been impacted because of treatments or because they've had cancer or organ transplants have been more likely to get infections with COVID, even though they've been vaccinated. And they've done studies now and shown that in those particular individuals, having a third shot has the ability to boost up the immune response and provide additional protection. So this is really great news that the FDA has now allowed these third shots to be given. And the advice that they have put out calls out these specific groups: organ transplant patients, people who've had cancer treatments, but they also indicate that people who have on immune suppressing medications and even immune modulating medications would be eligible. So in truth, that means that anyone living with MS who is on a disease-modifying therapy could theoretically be eligible to get the third booster shot. What we have suggested in our advice is that there are certain disease-modifying therapies that are much more likely to have this decreased effectiveness of the vaccine, and we would recommend people on those drugs go ahead and get the booster. And that would be those drugs we talked about, like the B-cell depleters, the S1P inhibitors like fingolimod, and then alemtuzumab. So for anyone who is on those medications and who has had their shots, and it's only for the mRNA vaccines, which I think we'll probably talk about, but if it's been more than 4 weeks since you had your last vaccination shot, you are eligible to go and get that third shot. So for those individuals, we definitely recommend that you take advantage of this opportunity to boost up your immune response.
So to repeat a detail, it's people who are on certain disease-modifying therapies can get a booster now. They could be categorized as immunocompromised, but not everyone with MS is immunocompromised, although if they're on one of the other disease-modifying therapies, they are immunomodulated, which would also recommend them for a third dose at this time. Am I getting that right?
John, you are really good at this. It's very complicated. Yes. So if you read the advice, the immune modulators include any of the therapies that we use for MS. If you read the CDC or the FDA guidance, it says immune modulators. But as I said, there's no evidence that people who are on those kinds of drugs like the interferons or Copaxone have a less robust response to the vaccine. So we don't consider those individuals as being immunocompromised. It's really the group who are on those more depleting agents like the B-cell depleters and alemtuzumab and the S1P inhibitors. Those folks, we do have evidence that they're immune suppressed to a certain extent and have decreased vaccine responses. So they're the ones who are most likely to benefit from that third additional shot.
Do we know whether people will be fully protected from a more serious case of COVID-19 after getting this booster?
So that's a great question, John. And the truth is we can't guarantee that, but it certainly increases the likelihood if you've had that third vaccine that you will have a less severe course of COVID if you happen to get infected. And I think this is the real point that we want to emphasize as we see more and more reports of these breakthrough infections, as they're being called. Let's remember that these are people who are testing positive for the virus, but they're not coming into the hospital, they're not ending up in the ICU, and they're not dying from COVID. And at the end of the day, that's what the vaccines were meant to do, and they are really doing the job, and they are working really well in that regard.
If someone experienced side effects with the first or second dose of an mRNA vaccine, can they still get the booster, and can they expect side effects from the booster?
Yeah, so there's having those kind of side effects after the first round of shots is not a contraindication to getting the third shot or the booster. What we do let our patients, people living with MS, know that sometimes when you get vaccines or you get a fever or some muscle aches and things like that, it may bring out some of your symptoms of the MS symptoms that you have had previously. Those are transient. It does not mean that you're having a new inflammatory attack or a new exacerbation of MS, but sometimes happens under those settings. So we recommend taking lots of fluids and analgesics, resting, and those typically are very self-limited, 24 to 48 hours, and then will be passed.
We've talked about the importance of timing your vaccination with your disease-modifying therapies. Does that hold true for the booster as well? Does timing the booster with some DMTs make sense also?
Yes, the same principles would hold for the booster as for the original advice that we gave on the other two vaccinations. So if possible, waiting at least 3 months since your infusion, if you're on a B-cell depleter, and then waiting at least 4 weeks after you get the booster to do another infusion. That gives you the best opportunity to have the most robust response to the vaccine.
And what about people who received the Johnson & Johnson vaccine? Has the FDA authorized a third shot for them?
They have not. And I know this is a point of frustration, but part of it has to do with the lack of data. And so at this point, the FDA is not recommending boosters for people who receive the J&J vaccine. That information, I think, will become available. I think there is work that's being done to test the effectiveness or the necessity for a booster with J&J. So we're just going to have to wait until we see that data emerge.
The FDA has issued an emergency use authorization for Regeneron's antibody cocktail for emergency use as a post-exposure treatment for COVID-19 in adults and young people 12 years of age and older who are at high risk for progression to severe COVID-19. And that would include hospitalization or death. So is this preventive monoclonal antibody treatment a substitute for a COVID-19 vaccination?
I'm glad you asked this question, John, because I just got one of my patients sent me a note through our portal asking if she should just do the monoclonal antibody instead of the vaccine. And I was shocked that this sort of information is out there. So just to be clear, the monoclonal antibody treatment is a treatment for an acute event. It does not provide any long-term protection against the virus. It would only be if you've been exposed to the virus to prevent you from getting sick within a time-limited period, within a week or two. It is absolutely not a substitute for doing for having the vaccination. So I guess it's the difference between taking an aspirin when you have a headache and being on a disease-modifying therapy to prevent you from having MS relapses over the long term. So the vaccine is going to give you long-term protection. The monoclonal antibody is just to keep you from getting sick if you've had a high-risk exposure. So I want to be sure that the listeners are aware of that. It's good to know about the antibody treatment, the monoclonal, the Regeneron, if you do get sick or if you get exposed. But it is absolutely not the same or does not substitute for the vaccine.
And is this antibody treatment recommended and safe for people with MS, including those who may be on some of those high efficacy disease modifying therapies?
Yes. So what we know to date is that the Regeneron treatment, the monoclonal antibodies, are safe for people who are living with MS and who are on those other medications. And as we have talked about previously, people who are on the B-cell depleters, we do know if they get COVID, are at a slightly higher risk for developing severe COVID, being admitted to the hospital, requiring oxygen, and so forth. So that would be the group that would have the most benefit potentially from getting access to Regeneron. So for anyone who's out there who is on those medications and has a high-risk exposure or has symptoms of COVID, please be aware that you are eligible for the treatment and it's free.
All of these new announcements and authorizations by the CDC and the FDA have been in response to the COVID-19 Delta variant that you mentioned a couple of moments ago. What can you tell us about the Delta variant?
So this was, we talked about this a lot before about the worrying about these variants, and now we've seen it come to fruition where we have a new version of the virus that is much more transmissible, that results in having higher amounts of virus in the nose and mouth, and just has taken over in terms of the transmission. And we see just heartbreaking numbers from places where there's low vaccination rates. So this is what happens with these kinds of viruses. The viruses make they modify themselves over time. And the more people that are infected with the virus, the more likely that these variants are to emerge. And what we've seen now with the Delta variant is that even people who are vaccinated can get infected with the virus and can spread the virus, even though they themselves will not get very sick. So this is, just part of the reason why we're seeing this surge that we are. But it also emphasizes the absolute need for people who are not vaccinated to get out there and get vaccinated, because the likelihood of getting sick is increased now because of the transmissibility of the new variant, and also because even vaccinated people are able to transmit it. It means this is why we're all putting our masks back on and not being able to feel like we can just go back to normal. So this is what happens when you have this large numbers of people infected. And we keep our fingers crossed that we don't have a worse variant that emerges because of all the surge that we're under, the so-called Lambda variant that I'm just starting to see reports of.
As you just mentioned, the CDC updated their guidance on wearing a mask, saying that it's to maximize protection from this Delta variant and prevent possibly spreading it to others, as you explained. Vaccinated people ought to wear a mask, should wear a mask indoors in public if they're in an area of substantial or high transmission. As it relates to people living with MS, are there any special considerations that they need to be thinking about?
So I think people living with MS, again, for some of the reasons we talked about, we don't want people to get sick. So we know that people living with MS are very savvy when it comes to their health care. And so my recommendation is to follow the CDC guidance, to wear your mask, to limit your exposure to large crowds of individuals, especially if they're not following the guidance and wearing masks, to really encourage your family members and other people that you might interact with to also get vaccinated. So really just to be vigilant and to continue doing what I think most of our patients have been doing, which is being very, very careful during this time.
You've actually covered this a couple of times in our conversation today. I only bring it up again because when you take a look at many of the social media posts, an awful lot of folks who are refusing to be vaccinated are now justifying their decision based upon the fact that people who have been vaccinated are being diagnosed with COVID-19. So I'm wondering if you could respond and explain one last time why it's still important for someone to be vaccinated, even though they may contract the virus.
Yes, John, I think this is an important point. And I can say it pretty simply. The reason to get vaccinated is so that you don't die of COVID. And we have seen that here in the hospital, the people who are sick, over 90% of them are unvaccinated individuals. And the people who are dying are pretty much 100% unvaccinated people. So the reason to get vaccinated is to not die from the virus. It's that simple. The other benefit of getting vaccinated is you stay out of the hospital. And as I said, our hospitals are really getting stressed because of COVID. We've been doing this for 18 months, and there are lots of other people that need other kinds of health care. So if you're not going to do it for yourself, think about your community, that you are going to keep yourself healthy enough. So if you did get the virus, you would be able to ride it out at home and wouldn't have to utilize the healthcare services or come to the emergency room or the hospital. And then finally, as we talked about with these variants, the more people that are vaccinated, the less likely that new variants are going to take hold. And as I said, we don't know what those new variants could be. They could be even worse. So the getting vaccinated shuts down the transmission to the point where the emerging new variants become much less likely. And it will finally allow us to move past this acute phase of the pandemic and move into what would be sort of the endemic phase, which is where the virus will probably be around, but will be manageable and will not be life-threatening.
I'll remind our listeners that they can find all of this detailed guidance that we've been discussing today on the National MS Society's website, and we'll have links to those specific web pages in today's show notes. Dr. Sicotte, I know everyone listening today appreciates all that you do to improve the lives of people affected by MS. I especially appreciate your willingness over the course of this pandemic to provide us with these really important updates. Thanks again for talking with me.
John, thanks so much. It's my pleasure. And based on the pace of the news, I think we'll probably be speaking again soon. And I'm happy to do it. So thank you.
As much as I enjoy our conversations, I'm afraid you're right. So be well until next time. Thank you so much.
Thank you.
We're seeing in situation after situation across the country that vaccine hesitancy, the reluctance or refusal to get vaccinated, puts everyone at risk. It extends the worst aspects of the COVID-19 pandemic, and hospitalizations and deaths are increasing every day as a result. Yet, in spite of what we see with our own eyes and hear from highly credible experts, millions of people still have concerns about the safety of the vaccine. In a moment, we'll meet a nurse practitioner who's living with MS who had some concerns about being vaccinated when we meet my guest, Victoria Holmes. Victoria Holmes is a nurse practitioner who specializes in pediatrics. Victoria received her Master of Science in Nursing from the University of Pennsylvania and is currently pursuing her Doctor of Nursing Practice degree. Victoria first presented with signs and symptoms of multiple sclerosis at the age of 18, and she was diagnosed with MS at the age of 29 just 2 years ago. Like some others living with MS, Victoria was initially hesitant to receive the COVID-19 vaccine. Welcome to the podcast, Victoria.
Thank you, John. Thank you for having me.
Before we talk about your experience with the vaccine, can you share what the first couple of years since you received your MS diagnosis have been like for you?
Yes, John, it's been pretty much a roller coaster since being diagnosed. Life started changing pretty rapidly, and I felt like I didn't really have much control over it. So as mentioned, looking back over the years, it seems I've been experiencing symptoms since about the age of 18, and that was such as trouble reading, trouble keeping up with other students in the class. And I also had some thigh numbness as well. But in 2019, I had a pretty major flare that left me with continuous arm and leg tingling and numbness, and I had trouble walking. My arm would go completely dead at work, like dead weight just hanging off of my shoulder, and I couldn't move it. And the most hurtful thing out of everything was that I developed a pretty significant change in my cognition. So my thought process, the speed has been very delayed now. It takes me much longer to catch on to information. My memory is non-existent, terrible brain fog, no longer able to multitask, trouble focusing. It's just devastating. I used to pride myself on my academic achievements, but after those flares, I felt, for lack of a better term, stupid and embarrassed. I went from being a thriving nurse practitioner, managing the care of extremely sick patients, to now being a patient myself. And of course, then came the depression, and I'm still grieving the loss of control over my body, loss of control over my mind, my life, my career. I'm only 31 and I feel like I'm losing it all. And then I kept having relapses and my symptoms kept getting worse. I had 2 different meds that I tried first, and I still was developing lesions, so they failed. So now I'm on Ocrevus, and I've been without any new lesions for the past 5 months, so I'm thankful for that. And then COVID hit. So now, of course, as an MP, I advocate for vaccinations. I strongly advocate for vaccinations. But now, on the flip side, as a patient, I'm immunocompromised. And we have a new vaccine out here. And I already can't control what's going on with my body. So do I really want to take the risk of getting this new vaccine? So my head was kind of going crazy. How can I, as a health provider, advocate for vaccinations when I don't even know if I want to take it myself? So here we are promoting vaccinations for COVID-19 after finding evidence that it is safe to have for people with MS, and new developing research is coming out. But so far, it seems that the best decision to make, and I've made that decision, is to get vaccinated.
And what was it that changed your mind?
Initially, fear is what kept me from wanting to get the vaccine. But then that fear shifted from what if I do get the vaccine versus what if I don't? So the world started to open up, and I realized that I wasn't vaccinated. I'm not protected at all from this virus, and I'm immunocompromised. So a double whammy there. But for me, I did need a little bit more information, more than just my doctor saying do it. You know, I needed more information from some reliable sources. So I decided to step out of my fear of getting the vaccine and get out there and do some research. And what I found completely changed my mind. It eased my fear. Things that I thought would happen really seems to be a myth. And ultimately, that even encouraged me to enroll into my doctoral program because I want to have my project geared towards vaccination hesitancy within the MS population. So that kind of made a big change in my decision to get the vaccine.
I think you said something very important that's probably worth exploring a little bit. And that is when you decided to look into things and do some research, you looked for, I think you said, reliable information. Talk a little bit about that and maybe talk about it in relationship to all the information available to us on social media.
Yes, so that was social media was a major source of information throughout the whole pandemic. More specifically, I was in a support group. I'm still in a support group on Facebook, a few of them. And one of the big questions that started to float around is, are you getting the vaccine? I'm not getting the vaccines. I am. I think that I'm going to get sick if I take the vaccine. And it was just so many speculations and worries. And, I heard this about the vaccine. I heard that about the vaccine. But there really was no source as to where these statements were coming from. So that really attributed to my fear initially. Like, I don't know if I want to get this. Maybe other people should start getting it first, and I'll see if they have side effects and things of that nature. But then, stepping back and saying, where is my data? Where is my data coming from? So I started to look at reliable sources such as the National MS Society, the CDC. I went to my provider to get some more information. And turns out most of the things that I heard on social media really weren't true. For example, the fact that the COVID vaccine is a new vaccine and it was created pretty swiftly. Actually, coronavirus in different variations have been here for over a decade now. So this is really not as new as we think. Is a different variant. And so we're exploring how to tackle that. So I thought that was pretty interesting. And me as a nurse practitioner, I didn't even really wrap my mind about that. I was so afraid of getting the vaccine that I didn't even look at the facts.
So when were you vaccinated and which vaccine did you receive?
I received the Pfizer vaccine, both doses back in April.
And did you experience any side effects once you received the vaccine?
Actually, John, I didn't. I had some fatigue, but mostly I think I just psyched myself out. I thought that I was going to be hit with this major response and I was waiting for it, but nothing happened. I was just tired.
Well, I think we all know someone who has experienced side effects after getting the vaccine. What do you say to others to help them feel less anxious about those side effects?
Yes, feeling anxious, I think it's pretty natural for anyone receiving this vaccine. But to ease the anxiety, I think it's important to get more information about the vaccine. Being well informed kind of eases the anxiety of getting the vaccine, because you know a little bit more about what the vaccination does, the effects of it, the outcomes of it. And so that really seems to ease the anxiety of getting the vaccine.
So I guess I'll ask you to almost repeat that, but maybe expand on it a little bit. Because, in spite of what the science tells us, some of the folks listening to our conversation right now still have concerns. So they aren't yet vaccinated, or maybe they have a loved one who hasn't yet gotten a vaccination. What advice about the COVID-19 vaccine would you share with people who are living with MS?
Well, if they continue with hesitancy, which is totally fair, I would first write down what is making me hesitant to receive the vaccination. What specifically are the fears? Is it the fear of the unknown? Is it the fear of getting more sick, triggering the MS? We have a lot of data out with reliable sources, but first identifying what is making you hesitant to get it. And then finding the answers to those questions by seeking a conversation with your providers or looking up CDC, National MS Society, or any information that could address those questions. We know that getting the vaccination has helped decrease significantly the mortality rate for those who contract COVID-19. So we do have that data out. And we also have a lot of information out there that might also help answer the questions that people might have out there that makes them hesitant to get the vaccine.
Well, Victoria Holmes, by sharing your story, I know you're helping people overcome some of their fears and get themselves vaccinated. Thanks for talking with me today.
Thank you for having me, John.
That's going to wrap up this episode of Real Talk MS. Real Talk MS is powered by the National MS Society. And you can share this episode of the podcast by letting your friends or family members know that all they have to do is point their web browser at realtalkms.com/208. You'll find that link in today's show notes, so you can easily copy and paste it right into an email or text. If you haven't yet done so, Please don't forget to visit the Apple App Store or the Google Play Store and download the free Real Talk MS app for your iOS or Android smartphone or tablet. It's the easiest way for us to stay connected. The app will automatically download the latest episode of Real Talk MS. You'll be able to save your favorite episodes, and it's a great way for me to share bonus content with you. So I hope you'll take a moment and download the app today. I'm John Strun. Thanks for listening. Stay safe and make healthy choices.